I'm Carlos Bonnot. I'm a veterinary practitioner from Wharton, Texas. Our practice is, we're in a mixed practice in a rural town. The majority of our large animal practice is cow-calf and cow-calf production. I became interested with several herds in 2006 and 2007 in the fall of the year that were experiencing some clinical parasitism. These herds expressed this 4 to 6 weeks post-deworming with an ivermectin product. We went and did a herd investigation, and in these herds we found an abnormally high fecal egg count, and that led me to believe that we perhaps are having some lack of efficacy with these particular products we've been using for a number of years. At this time, I was approached by Intervet Schering Plow. It just happened to be a coincidence that they started doing fecal egg reduction counts in herds. And I told them, I said, well, I have some great herds that this would work for because we've experienced a problem clinically last fall. We came to our clinic and we took some random samples this spring from 19 herds, and it ended up being about 822 samples from these herds. And these herds were dewormed mostly in March and April with the product that they've been using routinely. Many of these counts were way beyond my expectations, or our expectations, for having an effective spring wormer. So we took 2 of these herds and set up a trial where we wanted to evaluate ivermectin and ivermectin chlorshilon head-to-head along with fenbendazole. Okay. The basic trial process consisted of taking 2 herds of animals that we found had a high enough fecal egg count in our spring survey and doing a test on those 2 herds. We decided to evaluate ivermectin and the ivermectin chlorshilon combination. We took 40 mature cows from this ranch 1 and split them in 2 groups. The first 20 were run down the chute. The fecal sample was collected per rectum. The animals are individually identified. They were each giving the appropriate dose of ivermectin. The second 19 in that particular herd were run down the chute, fecal sample taken per rectum, and they were administered the appropriate dose of ivermectin and chlorshilon. We estimated these cows, these mature Hereford cows, to weigh 1,375 pounds, and we administered 12.5 cc's of ivermectin and ivermectin combination to these cattle. This rancher also had a group of heifers. They were heifers anywhere from 12 to 18 months of age. They weighed approximately 1,100 pounds. They were split up into 2 groups as well, the ivermectin group and the ivermectin combination group. These heifers were individually collected per rectum for the fecal sample and dewormed with 10 cc's of ivermectin. The following heifers, the other 20 in that group, were given ivermectin combination, and the samples were collected per rectum. 14 days later, we went into both groups and we collected samples individually from each heifer, and we administered fenbendazole. The following 14 days, they were all re-ran through the chute and fecal samples were collected. We wanted to evaluate the ivermectin product standalone, the ivermectin combination chlorshilon product, and then we wanted to evaluate fenbendazole. From the fecal egg reduction count in the mature cows, we found an acceptable level of parasite control. On the heifers, however, they did not pass the fecal egg reduction count standard of 90% reduction. We took this test one step further. We did a coproculture to identify the presence of the parasite that was of concern. It's important to know what parasite is present because some parasites are more pathogenic than others. And it's also important to know what product you're having treatment failure with that particular parasite so you can manage your parasite control program to fit the need of what you have to treat. The bottom line of all this, if I'm a rancher out here, which I am, as well as veterinarian, is that the ivermectin and the ivermectin plus product was not efficacious according to the gold standards that are set by the World Association for the Advancement of Veterinary Pathology. Not only did this make me aware that we have a product that we've been depending on for a number of years that may not be as efficacious as we once thought it was, it also tells me that I need to do more diagnostics with my producers. If I use a dewormer, I need to follow up with a fecal test to see if it was adequate. A fecal egg reduction test is fairly new for practitioners. It's using an old tool and using it in a different way to see if you have an effective deworming program. With the high cost of production now in a cow-calf situation, we cannot afford to use a technology or a product that is ineffective.